Hi, my name is Dr. Megan Shaner, and I'm a pelvic health physical therapist here to take you through some tutorials of progressions of exercises that I would use for my patients, ranging from pre-postpartum, stress incontinence, urgency, any fecal incontinence, all of those types of conditions. And we're going to be using some of my favorite external visual feedback as well. So this is our patient. Let's say, to keep it simple, she is presenting with some stress incontinence, and maybe she also has a grade 2 cystocele. And so she is going to be already good at, let's say, full range of motion of her pelvic floor. She knows how to use those muscles. We've already addressed any sort of internal components that we need to, and now we are ready to load and strengthen her pelvic floor. So we're going to start with one of my favorite exercises. We're going to take her through a bridge progression. So why don't you go ahead and lay on your back here. All right, and we're going to be using this MotionGuidance visual feedback for this exercise. All right. So I am going to have you go ahead and just lift your hips up off the table there for me. We're going to slide this MotionGuidance belt under her back here. You can go ahead and lower back down. I'm going to place it over the ASIS here. Go ahead and lift up one more time for me. There we go. Going to slide this through. All right, does that feel okay? All right. And then we are going to slide the mount in this way. And then the laser on top of it. All right. So the laser is going to be on the ceiling there, so she can see that as her visual feedback. So we're going to have you go ahead and lift your hips up into a bridge for me, and then I'm going to cue her to also lift and contract her pelvic floor, which we have already established prior to doing this exercise. So you have options to hold it as an endurance hold. You have options to keep the laser in the same position on the ceiling, as you can march this knee up to hit my hand here, trying to keep that laser still on the ceiling. So go ahead and give it a try. Good. Bring it back down, and then your other side. Good, and bring it back down. So this is another really nice opportunity to do some gravity-assisted strengthening of the pelvic floor for your patient who has a prolapse or who needs to practice some one-sided loading of their SI, which we know is also a common condition that we'll see with these patients as well. You can also keep the laser where you need it to be. Don't let it move as you relax and contract your pelvic floor. So it's a nice opportunity to practice some coordination in, again, a gravity-assisted position here. All right, you can go ahead and lower your hips down. The other option that we have here is another common exercise with our pelvic tilt. So we want to create that co-contraction of our deep core muscles and the pelvic floor. So if you can, I want you to look where the laser is on the ceiling, and you're going to contract these muscles right here and think about flattening your lower back on the table. Good, and this is a great tool for those patients that do not know how to use these muscles, right? Because they can see the laser starts in one position and then will shift back behind them. You can go ahead and relax. And then we can add the second layer, so we can have her, again, do that pelvic tilt, watch the feedback go behind you, and then you can lift and contract the pelvic floor to create that co-contraction there. You can hold all of that as another progression, and again, add that march. So your goal is to keep the laser still as you bring this knee up to hit my hand here. Good, and come back down, and then this one. Good, and come back down, and then you can relax your pelvic floor. Okay. So let's have you go back up into that bridge position. So go ahead and lift those hips up, contract your pelvic floor, hold that all nice and still, and then we can see where the laser is on the ceiling there. So when I have her lift this knee up to hit my hand here, what I'm looking for, there you go, is if the laser is moving side to side. What that tells me is that this patient is not stabilizing through the opposite side. She's not loading that side the way that we want her to, and she's not able to control that. So it's really good feedback for me, and it's good feedback for her as to where she is in her progressions. So let's try that again. So you go ahead and march your legs, try to keep that laser still, and I'm gonna watch that for some feedback. There we go. Good. And we see a little bit of movement there, right? So that's where I can put my hands on the patient too, and maybe I saw that it was moving more when she loaded through this side. I can help cue her by putting my hands on these muscles through her glutes to try to help her load that side a little bit better. Go ahead and you can put your hips back on the table. Same thing will go with our pelvic tilt progression, right? So go ahead and contract these muscles and flatten your lower back. Good. Now, from a clinician standpoint, I want to see if that laser moves towards me. That tells me that she's not holding that pelvic tilt and that she might be compensating with some lumbar extensors or with her legs or other things that we don't want to see. So go ahead and hold this as tight as you can and then do a little march with your right leg and then your left. And I'm going to watch the laser here. Good. Great. And she did a really nice job with that one. So you can go ahead and relax there. So this patient would be ready for maybe a more advanced marching progression or getting out of the gravity assisted position and getting into maybe some more sitting or standing progressions.